how would you know when it was time to take your dog in for an eye exam? The things come up quickly with eyes: increased or persistent squinting, tearing, redness, or rubbing. The biggest one of those four would be persistent squinting. That's usually nothing benign. If the pupils are very big, dilated pupils, dogs suddenly can't see. Big one when they walk into the walls. There's usually a good reason for that.
Today we have a very special guest, Dr. Marnie Ford, and she is a veterinary ophthalmology specialist.
I'm really glad to be here.
Do you have any pieces of advice or wisdom that you're learning to share?
So one thing that I wanted to just say is, how would you know when it was time to take your dog in for an eye exam? What would give you the tip-offs? If your dog is having increased or persistent squinting, tearing, redness, or rubbing, that would be a reason enough to go and have a good chat with your vet and just say, hey, can you just check his eyes? They're normally checking the eyes at every exam anyways, but things come up quickly with eyes. The biggest one of those four would be persistent squinting. That's usually nothing benign. That's usually something that, there could be an ulcer or there's some pain or something going on. So persistent squinting is something that's not hard to miss if they're walking around like this for the whole day. So squinting would be the big one. I always remember those four things. I always think if you were at the beach and somebody threw sand in your eyes and you had no arms, you would do exactly the same thing. You'd be squinting, tearing, redness, and rubbing. So those would be the easy ways to remember it. And then other things that would be a good tip off to go and see your vet, and they're a little more obvious, would be dogs suddenly can't see. It's a big one when they walk into the walls. There's usually a good reason for that. If the pupils are very big, dilated pupils, or even just one eye is big and dilated, that's another big thing. So that's where the big pupil, the black spot, is much, much bigger than the other eye. So those are really good reasons to go to your vet as well.
Okay, those are great tips.
Every veterinarian should be able to address your initial concerns when it comes to concerns that you have about your pet's eyes, dog, cat, horse, whoever is your regular vet. And referrals can be made to ophthalmologists directly from your clinic. There are 4 ophthalmologists now, or 4 clinics now in British Columbia. We're super lucky. It never used to be this way.
Wow.
So Victoria, Kelowna, New Westminster, Vancouver. So lots of good locations. And it's not as expensive as you think. People often think that going to the ophthalmologist would be super expensive. It's really just not. The initial consult, which will put you on the right path to treatment, is really not as expensive as you might think. And a lot of the time, the patient is sent back to the referring vet for ongoing care if that's needed or where possible. So it doesn't mean always having to take trips out to Kelowna or wherever it is that you have to go. So veterinarians are able to contact the ophthalmologists as well for advice. And that happens quite a lot as well. So lots of options.
I think it's really good for people to know that there are ophthalmologists out there. If you ever need a second opinion, if things aren't getting better, or if you're dealing with something advanced affecting vision and you want to explore all your options, then seeing an ophthalmologist is a really great avenue. Yeah. And does ophthalmologists accept medical insurance as well?
Pet insurance? Mm-hmm. Oh, absolutely. Yeah.
So that's probably really helpful to have in cases, especially if surgery on the eye is needed.
Oh, yeah. Yeah. Good.
Awesome. Well, thank you so much. So great having you.